Have you heard that Kevin Samuels is dead?
All right, so Kevin Samuels' cause of death was reportedly hypertension per a report from TMZ.
Rest in peace to the Godfather, Kevin Samuels.
Rest in peace.
What caused the death of Kevin Samuels, and what lessons can be learned? Although YouTuber Kevin Samuels may have been controversial to some, his sudden passing was a shock to all. That being said, there are still some unanswered medical questions, and today we will explore them. Welcome, I'm Dr. Dre, board-certified internal medicine doctor. Today, I wanted to do something a little bit different. Obviously, we're discussing the topic of Kevin Samuels and his death. I'm going to explore his medical history and potential underlying cause of death. I will provide a clear and unbiased look at the medical facts. I do think that there's lessons to be learned here that everyone can take away from. And in this discussion, we'll find out a lot. So let's dive in. So let's start at the end. We know that Kevin Samuels passed on May 6, 2022. His reported cause of death by the media was hypertension. However, this is inaccurate since hypertension is not a direct cause of death. It is a risk factor that contributes to a cause of death. Hypertension, yes, can lead to stroke. It can lead to heart enlargement, heart failure, kidney disease, kidney failure. But again, hypertension is not a cause of death. Alone, it is not a cause. Now, we do know that Kevin Samuels was prescribed a drug, atenolol. It belongs to a class of medications called beta blockers. Now, can beta blockers be used to treat hypertension? Yes, but that's not the full story. One of the things you need to know is that beta blockers are not considered first-line antihypertensive medications. So in other words, it is not something that your doctor would first pick up and give for your treatment of hypertension. First-line antihypertensives include angiotensin receptor blockers, ACE inhibitors, calcium channel blockers, and diuretics. Moreover, the first-line antihypertensives that are preferred to use in African Americans and Blacks are diuretics and calcium channel blockers. So then that being said, what's the deal with this beta blocker, atenolol? Well, what are the indications for this medication? Well, it's used in coronary artery disease, myocardial infarction, heart attacks. It's used in arrhythmias, abnormal heartbeats, and it's used as an additive antihypertensive medication. So it's added to other hypertensive medications in certain conditions. I cannot say that Kevin Samuels had one of the diseases I just listed, but I can just tell you what the medication is and what it's used for. But keep that in mind, I'm going to come back to this medication. Now, the death of any popular figure is always shrouded in rumor and speculation. This was no different with Kevin Samuels. One popular belief was that his death was related to the consumption of energy drinks, Red Bull.
Oh, but I will tell you all this because I spent time with him. He did drink a lot of energy drinks.
I understand this thought, however, this is extremely rare. Possible, but not probable. Death related to energy drinks or the overconsumption of caffeine is typically associated with an underlying arrhythmia, which is an irregular heartbeat. With no such known medical history and the rarity of such a cause of death, it is extremely unlikely this is the cause. But let's explore something that is more relevant to Kevin Samuels.
I had cancer.
Oh, you had cancer? Wow. What kind of cancer?
Hodgkin's.
Okay, I'm not familiar. What is Hodgkin's exactly?
Hodgkin's is a type of lymphoma.
And is this like a deadly form of cancer if it goes untreated or?
It has one of the most highest cure rates, but like anything else, it can kill you. During surgery, I guess, from what I remember, they actually said it started out malignant. So long and short of it, they closed me up because they shouldn't have operated in the first place. And then from that point, treated it with chemotherapy.
People forget that Kevin Samuels was a cancer survivor. And people do not know how this can greatly impact your cardiovascular health. Specifically, when it comes to Hodgkin's lymphoma, this risk can be greatly increased. Now, of course, this depends on the stage of the cancer, the patient's individual health at the time of the diagnosis, and the treatment type chosen, because treatments can also affect you. That being said, I want to go through a list of reasons why such a diagnosis can be detrimental to your heart. So the first is chronic inflammation. Malignancy, cancer of any type can increase or cause inflammation, and that inflammation can affect your heart. Inflammatory molecules are released with battling cancer, and that can affect your cardiovascular system, specifically your heart. The inflammation can also cause cardiomyopathy, which is the disease of the muscle of the heart. The inflammation can also cause plaque buildup, atherosclerosis, which is narrowing of the vessels. Chemotherapy. Chemo is used to battle or fight cancer, kill cancer, but it also can kill or damage cardiac cells. So the type of treatment you use, again, can affect you cardiovascularly. And ultimately, certain chemo drugs can lead to heart failure or irregular heartbeats. Radiation treatment, when you're treated with radiation exposure to the chest or to the heart can cause plaque formations, can cause hardening of the heart and hardening of the arteries. This is called atherosclerosis. So considering all of this, it is clear that Kevin Samuels did have increased cardiovascular risk. However, it is impossible to quantify how much risk. We do know that he did have a diagnosis of hypertension, Hodgkin's lymphoma, and he underwent chemo. Now again, turn back to atenolol. The only thing I can speculate is maybe he had another diagnosis and this medication was used. But I can't give you a specific diagnosis just based off those facts. I can make an educated guess that Kevin Samuels did have some type of cardiomyopathy. And this is a broad term, again, for damage to the heart muscle. What I can confidently say is that he did have significant cardiovascular risk factors, and these can be a major contributor to cardiac death. In general, identifying cardiac risk factor is a vital step in maintaining one's own cardiac health. Identifying them in Kevin specifically can allow us to understand how the accumulation of these risk factors increase the likelihood of heart disease. Now, the risk factors associated with Kevin are as follows. He had a diagnosis of hypertension. He had a diagnosis of cancer, Hodgkin's lymphoma. He also had chemotherapy, which he did list, but also he was a male. That is increased cardiovascular risk. And being African American itself, yes, is a risk. Now, again, I can just say that all of these added up do increase the probability of cardiovascular death or disease. Now, heart disease stands as the #1 cause of death in the United States. And the only way to really understand this is mitigating those risk factors. Once we can battle these risk factors or lower some of these risk factors, it is beneficial to everybody and every individual. Now, if you're a male, it's even more important because, again, being a male is a risk factor on its own. And if you're like me and you're a Black or African American male, that's 2 risk factors we do have to battle just off the bat. Now, the important thing to understand is that risk factors come in 2 categories. First category is non-modifiable risk factors. What this means is things that you can't change. You can't change the fact that you're male. You can't change your genetics. You can't change your family history. You can't change your race. So you have to understand that you have these risk factors, and maybe you work on risk factors that you can change to help you. So this goes into modifiable risk. And yes, there's a list of modifiable risk factors that we can help change to help our cardiac health. So the top modifiable risk factors are hypertension, right? So if you treat your hypertension, you exercise more, maybe you're placed on medication, yes, that can help your cardiovascular health. High cholesterol, diabetes, obesity, battling inactivity, excessive alcohol intake, unhealthy diets, and smoking. All of those are risk factors that we can change and manipulate. Again, increase our overall cardiovascular health. Now, reduction or identifying these and helping to battle against these is exactly what preventative healthcare is all about. And it's important for everyone to understand their personal own risk factors. And who can help you? Well, your primary care physician can help you come up with a plan, identify these risk factors, and work against it. And this can be regular exercise, again, change in diet, all those things I previously mentioned. Overall, it's important to understand that there's cards that we are dealt with, there's things that we can change and things that we cannot change. But we do have to make a positive step forward. While we may never know the exact cause of Kevin Samuels' death, we do know he had risk factors, and that's important for us to understand and to battle against. I do encourage everyone to check up with their doctor, have a plan, and work towards that. And with that, I'd like to say,
all right, man, until the next time, what are we going to say? Peace. We are gone.
to everybody else, stay safe and stay curious. Until next time.